Hello, my name is Trucy Truong-Phan, and I'm an undergraduate research intern for Youth for Wellness at Yale. I will be presenting on our pilot study to evaluate a digital game targeting suicide prevention in adolescents who misuse substances. The principal investigator of this project is Dr. Claudia-Santi Fernandes. Suicide is the second leading cause of death in adolescents aged 14 to 18 years old. Additionally, misusing prescription substances puts adolescents at a higher risk of experiencing suicidal thoughts and behaviors. To address this issue, we developed a digital game called Support Ed, co-created with our Youth Advisory Board, Youth for Wellness at Yale, to prevent suicide in youth who misuse substances. Our initial study focused on just opioids, but we decided to expand to include additional substances based on our formative work that was presented last year at the UConn M.H.S conference. We conducted a pilot study to assess the usability, acceptability, and feasibility of delivering Support Ed and associated protocols in schools, given the sensitive nature of this work. We also explored secondary outcomes in experimental groups compared to the control groups at baseline, post-intervention, and the 3-month follow-up mark. Here are some examples of our measures. We want to highlight that we use validated scales in anxiety, depression, and suicide, among others. The pilot study was conducted at 2 partner high school sites, Miami, Florida, and Meriden, Connecticut. We had 60 eligible participants who were then randomly assigned to the Support Ed intervention group or the control group. And this is a breakdown of our recruitment and participation outcomes. Our target enrollment was 60 students. We enrolled 29 students from Miami and 32 students from Meriden. 61 students completed baseline questionnaires, and 1 student was excluded due to ineligibility. So we had a total of 60 students randomized into either the control or intervention group. 29 students were in the control group and 31 students were in the intervention group. We are currently completing our 3-month follow-up. To date, 28 students have completed the follow-up, and we are at the second high school location to gather the remaining data and complete this portion of our study. And these are the demographics of students who participated in the pilot study. 56.7% of participants identified as female, and almost 70% identified as Hispanic or Latinx. And the age range for students was 14 to 19 years old. As we said, we currently do not have any results at this time besides demographics. We are currently in the middle of completing the 3-month follow-up, and data analysis will take place in the summer of 2023. The findings from the pilot study will inform future iterations of the digital game and can offer an innovative solution to address the youth mental health crisis in schools. Thank you for listening and enjoy the remainder of the conference.